Democratic Republic of Congo. Authorities in the Democratic Republic of Congo said that 50,000 doses of mpox vaccine from the United States arrived in the country on Tuesday, a week after the first batch arrived from the European Union. Adults in Equateur, South Kivu, and Sankuru, the three most affected provinces, will be vaccinated first, starting on October 2nd, said Chris Casado-Sako, coordinator of the DRC's Monkeypox Response Committee. Last week, the first batch of mpox vaccines arrived in the capital, Kinshasa, the center of the outbreak. The 100,000 doses of the JYNNEOS vaccine, manufactured by the Danish company Bavarian Nordic, were donated by the EU through HERA, the bloc's agency for health emergencies. Another 100,000 were delivered over the weekend. The 250,000 doses are just a fraction of the 3 million doses authorities have said are needed to end the mpox outbreaks in the DRC, the epicenter of the global health emergency. EU countries pledged to donate more than 500,000 others, but the timeline for their delivery remained unclear. Since the start of 2024, there have been 5,549 confirmed mpox cases across the continent, with 643 associated deaths, representing a sharp escalation in infections and fatalities compared with previous years. The cases in the DRC constituted 91% of the total number. Most mpox infections in the DRC and Burundi, the second most affected country, are in children under age 15. Last week, the Africa Centers for Disease Control and Prevention and the World Health Organization launched a continent-wide response plan to the outbreak of mpox, 3 weeks after the World Health Organization declared outbreaks in 12 African countries a global emergency. The DRC issued an emergency approval of the vaccine, which has already been used in Europe and the United States in adults. For the moment, the rollout will be reserved for adults, with priority groups being those who have been in close contact with infected people and sex workers, Africa CDC Director General Dr. Jean Cassia told reporters last week. The European Medicines Agency is examining additional data to be able to administer it to children ranging in age from 12 to 17, which could happen at the end of the month, HERA Director General Laurent Muschel said. The next batch of mpox vaccines will come from Japan and could arrive as early as this weekend, Casado-Sako told the AP, without specifying how many doses.